Hello, Capstone. Today I'm going to go over some of um, the most common categories missed on exit. It's basically some of the most opportunistic points that you may have in preparation for your upcoming next attempt at exit. Okay, so I'm gonna talk a little bit about a few categories that could certainly use improvement on, and hopefully that can structure where you guys are planning your studies at. If I look at and analyze the exit as a whole, I can see there's some opportunities for health promotion and maintenance. Okay. Now, this is looking at client needs. According to the NCSBN, the people who make your NCLEX, right? That next gen NCLEX, upwards of 18% of your next gen NCLEX is on health promotion and maintenance. And if you have to look at that as a client needs category, when we're looking at it, I'll use chapter 4 in your Hesi book as an example. And what they're talking about is if you're looking at these concepts, right? Let me just get to one here. If we were to look at lung cancer, right? You have the assessment portion, the nursing plans, interventions. You're going to also have a brief overview of the concept. And the idea is to take what you can learn from the concept in a very short analysis from the Hesi book or from your remediation packet. Those remediations are extremely important. They can be the key to your success for preparing for the next one. But if we look at the health promotion and maintenance categories, we need to make sure that we can understand the patient teaching, the medical management, the preventative maintenance. That's what that category is talking about, right? So if we are looking at lung cancer, pardon me, pardon me about that. All right. So back to this, I was talking about health promotion and maintenance, right? So if you're looking at lung cancer, one of the maintenance items is the purse. You might have to teach purse lift breathing, right? And how can you promote that? How can you maintain their their overall baseline with the lung cancer? Again, the health promotion part is, can we deliver, excuse me, adequate oxygen therapy to maintain a certain O2 stat? Maybe the order is to maintain 92% as an O2 stat. So that's going to be our goal for health promotion and maintenance, is to make sure that we are adequately providing oxygen therapy to promote health and wellness. Okay. And again, a patient with lung cancer, depending on the stage and the correlating diagnoses, right? We need to maintain either their baseline or optimal health and wellness to the best of our ability. Okay. And again, I'm looking at this right now in a client needs category. I will get into nursing concepts in just a moment, but I want you to see how this can promote success on the NCLEX as well. Safe and effective environment. Yes. If I'm going to use lung cancer again as an example, but what if you had to adequately maintain their posture? Okay. Why do I say their posture? Maybe we need to have them sit up in a high Fowler's position. That has a safety mechanism with it. What about an effective environment? Well, this patient, if they need oxygen therapy, right? because people, if they need oxygen therapy, or maybe they need a chest tube, right? We're not going to send them to a floor that doesn't do chest tubes. We're not going to assign them right to an LPN. That's going to be the RN's patient because the PN is not going to be able to manage within their scope the chest tube. They can look at it, assess it, tell you some things about it, but that's not in their scope. That's your specialty. That is an unstable patient. Okay. Um, Patient can't breathe, right? ABCs, lung cancer. If they're on oxygen therapy, they're in a high Fowler's position. Do you think they'll have some anxiety that goes with it? Well, yeah. We need to maintain a safe and effective environment. Create that therapeutic milieu. That's what this client need subcategory is talking about. Physiological integrity. Okay. What exactly does that mean? You have you have two differentiations here. You have physiological, the body, then you have psychological, right? Or psychosocial. What's happening with them, around them, what's happening at home. More intrinsic, but the physiological integrity, again, relates back to the patient condition and how we can keep the patient safe, informed, how we're going to recognize clues to their signs and symptoms, or how astute are we are picking up their signs and symptoms, right? When we're looking at a patient and assessing them, okay, I'll use lung cancer again. It typically has a poor prognosis. Those patients are going to need a lot of teaching, education, care, maintenance, interventions. Okay, it is definitely an unstable patient. They may need a surgery, maybe a lobectomy, right? That's one of the typical ones you may find depending small cell. Anywho, let me not get too distracted, but the physiological aspect, what is happening to their body, right? Do they have can they not breathe? Are they experiencing dyspnea? Is their voice hoarse? Right? What is happening with them? Are they fatigued? Okay. Are they able to do any ADLs? What's happening with them? Okay. Vital sign. Your your method or your way or your recognition of understanding or interpreting the vital signs is going to be key to their overall health and wellness. Okay, keeping their pain under control, right? Because that's going to be a cancer patient. That's basically what it's talking about here. And then the psychosocial aspect of it, okay. Like I was saying with the example of the lung cancer, that neoplasm in the lung, right? That abnormal scan that they had that detected this. Okay, maybe they went in for a CT of the abdomen pelvis and then found, this lovely finding incidentally, right? That could happen. Hemoptysis, right? Going back to physiological integrity, are they coughing up blood, which would be abnormal? But shift the gear back to psychosocial integrity. What are they going to need? If they're experiencing anxiety related to their disease process, how are we going to help them? We need to teach them calming skills, relaxation technique, even the breathing pattern that we teach them, like the pursed breathing, excuse me, could help. You want to let them have as much control as possible. That's going to decrease their anxiety because related to the theory of humanism, we have a fear of the unknown, right? If you educate your patient, you collaborate with them, and you give them control, they're going to be calmer and they're going to appreciate that. All right. So those are some of the top three weak categories here. And why did I go over it? Is because I want you guys to use these opportunistic areas to focus your study tactics. Again, this is as a group. This is not individual. This is as a group. Now let me switch categories here. Let's go to concepts because that's what we learned, right? The top three concepts missed on exit Hesi as a group was intracranial regulation, sexuality and reproduction, mobility, and perfusion. But I'm going to go over a few more, okay? So in order to plan for success, intracranial regulation as a nursing concept, your ICP, your medical management of ICP, typically there wasn't too many questions on this. It was less than 10. Okay, but 10 can really make a difference, right? So we want to notate that. Sexuality and reproduction. Okay, in here in your med-surg book, let's see what chapter that starts at. I'm pretty sure it belongs in the maternity nursing. You're going to find some in chapter 4, depending on the disease process and the area of the body it affects, but you'll find it in the Saunders book as well. Or in your remediation packet, which is ideal. But again, less than 10 questions on an average. The bread and butter, which you guys had between 10 and 20 questions, depending, was mobility. So your musculoskeletal system. You had about 18 questions on 16 questions on metabolism. So what are they referencing with metabolism? They could be referring to how the body is using nutrients depending on how the question had it set up. Which disease process utilizes what diet, because that'll depend on how the body's breaking it down. It could be related to GI as well. I would reference your remediation packet for metabolism concepts. Inflammation's on there as well. Again, less than 10, but that 10 can be significant, right? So your inflammation, you want to make sure that you understand the process of infection and how that your body as a cellular being mediates inflammation and why it's significant, right? So we have an area of insult or a cut, right? What's going to happen if that cut gets infected? You have some foreign invaders because now that cut becomes a port of entry. What's going to happen is you're going to have a foreign material come in, start the infective process. Histamine rushes to the area of insult, sounds the 5 alarms, say, woo, we have an infection over here, right? Causes vasodilation, getting an increased blood flow to the area. How do you see that on your assessment? Your signs and symptoms of inflammation or infection is warmth, redness, swelling, right? Because of the vasodilation from the histamine. So when people are in an allergic reaction and they're getting hives all over their body and you take Benadryl, it's an antihistamine. It kind of follows along in the same pattern when we're talking about inflammation as a general nursing concept. Okay, so histamine comes to the party, vasodilation gets the blood flowing, and the blood automatically signals those soldiers of the white blood cells, and they're coming to the party as well. They're saying, hold on, what's happening here? Let me fight, let me engulf, let me phagocyze, let me get them out of here, right? But what if there's not enough white blood cells because they're all dying? You see that as pus, pus, drainage coming from the wound, the exudate, right? Now, all of a sudden, we're going to need some immature soldiers, the Army Reserves, which are the neutrophils, which you'll see on your CBC with differential that you can look up in this book, okay, and see that the neutrophils are now activated. Okay, they're coming from the yellow bone marrow and they're getting an increased amount to that area of insult to get rid of the infection. Maybe it's bacteria, maybe it's fungus, not really sure. But if the white blood cells are coming, you're seeing a spike in the white blood cells, typically it's going to be a bacterial infection. But also what happens, because I'm going to talk about perfusion next, right? Regarding perfusion, I want to talk about cascading factors because same thing with inflammation during that area of insult, that cut, you're going to have cascading factors, right? And our liver promotes some of these cascading factors, okay? You're going to have fibrin, fibrinogen. You're going to have platelets that aggregate to stop the bleed, right? They're going to aggregate and stop the bleed. The platelets are held together with fibrin due to fibrinogen, right? All that happens because we have a signal from the body saying, hey, we got to cut. And the liver goes, I'm coming, and releases all these cascading factors, right? So when you have disease of the liver like cirrhosis or NASH, um, that becomes problematic because we cannot control the bleeding times the right way. What are you going to look at for to control bleeding, right? You're going to have heparin, which you want to look at the APTT, because if it's too high, you're putting them at risk for hemorrhage, right? You also want to watch platelets, because heparin can put you into heparin-induced thrombocytopenia or HIT, which is deadly because they're going to literally start bleeding from like their cuticles, the corner of their thumb, their nose, orifices, right? That's going to be a problem. Your warfarin Coumadin, we're looking at INR level. We're teaching about the, you know, watching what they eat, like leafy green vegetables with vitamin K, but also the things that have hidden vitamin K in it, like cantaloupes, avocados, right? Almonds, I believe, are on that list. I've double checked pistachio, things of that nature, and all that just from talking about inflammation. Your next one is mm, nursing assessment. I have mixed emotions on this. I feel like generally most of you scored quite high on your nursing assessment, but there was a few that could use some assistance or an opportunity area with the assessment. So suggestion is to get into your med-surg book in chapters 3 and 4 and utilize the nursing assessment as a way to guide your studies on these concepts we're going over. Regarding perfusion, are we comfortable with MAP? MAP needs to be above 65. Are we comfortable with knowing the stages of hypertension? The patient will earn an antihypertensive medicine if they have consecutive blood pressure systolically over 140. And you'll find that in between chapters 3 and 4, but you'll also find in the Saunders book the stages of hypertension. Perfusion relate and the significance of MAP above 65 is that you'll have organ perfusion at 65. Your ICU nurses, let me tell you a story. As a med surg nurse, when I was brand new to med surg, I would panic if I had a blood pressure 75 over 60 or 75 over 55, and I started looking at MAP. And as long as MAP was above 65, I wasn't panicking anymore, and I would start planning adequate care and management or IVs or whatever the case needed or calling the doctor. But you learn to plan and time manage better if you can remember or utilize the concepts that you learned in school. And you don't realize how much you learn here until you're out working. Okay. um, Clinical judgment and decision making. You chapter 3, okay, where you have the advanced clinical concepts. This can help you solidify some of these critical thinkings. I like to have students review the Hesi hints in chapter 3 for this clinical judgment no, critical thinking value here that seems to help. Evidence-based practice. We had a big opportunity here. The only way to improve on evidence-based practice is by utilizing the most up-to-date Hesi book, which you guys have. Okay, that's going to be your version uh, 7. Okay, you can still utilize 6 for preparation. That's not a problem, but if you're using version 5, that may not be conducive to success. Infection, I talked about stages of infection. Comfort, checking out when you're studying and you're looking at the interventions, comfort measures relates to a therapeutic environment and safety as well. You want to look at how the patient should be seated or how they should be positioned, I should say. That would be the better thing to say, for the disease process. Because again, if we have a patient who cannot breathe, or what if a patient's having acute pancreatitis, right? Your textbook will teach you that the fetal position is probably one of the most comfortable positions for them if they're able to get in that position. And sometimes you can even assist them as long as it's safe for them. Teaching and patient education, that goes along with reading through the nursing plans and intervention, because in the Hesi book, they do hide teaching aspects into the planning and interventional areas here. Um, Oxygenation and gas exchange. So again, utilizing your ABC, your chapter 4 of your med-surg book, and focusing on the respiratory aspect of it. Okay. Um, Hang on, there is something. That's acute kidney. Am I? So if you notice as you go through the Hesi book, it's separated by systems. That should not be any news to you guys. But if you're looking at this and you realize that if you, my suggestion is you go into your old Hesi, review the remediation, and then utilize the book to solidify that, or the Saunders book. Okay. Fluid and electrolyte imbalance. There is a great resource in your Hesi book. So talking about fluid and electrolyte imbalances, I've got a video I'm going to share with you guys so you can review some of the differences between how to see if they're in respiratory versus metabolic acidosis or alkalosis. Let's see the next concept, immunity. So nutrition comes into mind for immunity as well. Cell-mediated immunity. What markers do we use? Meaning, if we're looking at a CBC with differential, what are we looking at? If we're thinking it's bacterial infection, what are we looking at? If we're thinking it's more of a viral infection, what diagnostic studies we can utilize? Like if it's respiratory, do we want an X-ray? Do we want a CAT scan? Maybe the pain is coming from the GI area. Are we thinking H. pylori? Are we thinking ulcers? And how can we see how the body is reacting to the disease processes? Immunity also has to correlate with neutrophils. It can even go along with basophils, eosinophils. Okay. Um, Knowing those normals will help you, and knowing what the significance of basophils, eosinophils, um, how you can differentiate between an acute asthmatic attack and a chronic asthma. Okay, you're looking at eosinophils. As well, you can look at oxygen saturation. You can look at overall assessment of the patient. How are they breathing? What's their breathing pattern? Is it labored? Is it symmetrical? Do we have equal chest rise and fall? Let's see here. The rest of them, guys, look pretty good. Those are the most commonly missed or shared concepts from your previous exit exam. Um, you continue using your Hesi book, but also if you have a question about a diagnostic study. Now, this is an old version, but this book is amazing. Maybe you need to update yourself on what exactly a CAT scan is going to do, or what arthroscopy is, or why is a protein level so important, or prolactin. Okay, because this can tell you, especially if you're having problems with understanding colloid medications, right? Or what that actually is, how it relates to albumin. If you go in here, it's going to tell you exactly what you need to know and how to go through it, right? Because albumin is formed from the liver. It is a protein, and it relates to our total protein and how our fluid and electrolytes are balanced. If we're third spacing, what are we going to do? Can we give them albumin? How is it given, right? It's going to talk about immunoglobulins, like related back to immunity, IgE, IgD, IgM, IgA. What are their significance? The significance of those. All those correlate to what disease process they're going through. And if it's something where you're thinking inflammatory process, well, maybe I want to see where their IgG is, right? And we can look at that. If you want to go into like becoming an infusion nurse, that's something that they give in the infusion centers, and we give it on the floor too. Um, let's see what else here. Most commonly tested items. INR, prothrombin time, okay, your PT INR. And it tells you in here like the indication of why someone would have a PT and INR, right? Are they on Coumadin, warfarin? What's happening? Are we looking at the activated partial thromboplastin time for heparin? Which one would you want to look at? You really don't have to worry about yet MCV. If you're looking at a CBC and you're thinking about what is MCV, the mean corpuscular volume, we don't need to know that just yet. Mean corpuscular hemoglobin, that helps you differentiate between macro and micro anemia, which you don't get that deep into it now. I've had some students ask me, and they're not testing you on that. I had a student come in concerned with that. First of all, that wasn't even on the exit Hesi, so I don't know how that became a conversation. But I don't want anyone confused on what you should be reviewing. Now, if you want to look at it just for general knowledge, not a problem, right? So remember your IgG, I'm still talking about immunity. Your IgG is going to evaluate basically your immune status or what's happening. IgM, right? Do we have an active infection? These are some of the different variations. I'm not going into that. Just trying to review some most common labs here. I'm not going to be testing on testosterone. TSH, I would review TSH, what the normal value is, how it relates to the thyroid disease processes. Okay, you can find, again, Mosby's lab manual is great. Your Saunders book is wonderful, because how are you going to differentiate whether we've got what type of issues we have with the thyroid or the parathyroid, your PTH? Okay. Reviewing the CBC, I think I said that already. Review BUN and creatinine, okay? Where, BUN is measuring the amount of urea nitrogen in the blood, how that's formed, right? It's going to come from your liver. It's the end product of protein being metabolized, right? That's why it stems from the liver. It also comes from digestion and breakdown of amino acids, which is, again, an important part of metabolism. Amino acids, we need those. We need those for DNA synthesis, right? Certain levels. We also can measure, is the patient dehydrated? Do we, looking at your GFR, okay, that can help you differentiate between acute kidney injury versus chronic kidney disease. Looking at that GFR, what meds you want to avoid with a patient with a GFR of 60 and or below, right? They should avoid NSAIDs and products that contain silicates. Let's see what else here, guys. Safety, that was good. Well, I went over the most common categories. I will send you this video regarding acidosis and alkalosis. I think it's a nice simplified way to understand it. If anybody needs math assistance, Professor Miller on Tuesdays 1 to 2 p.m. and Wednesdays, I think it's 5 to 6 p.m. or 5 to 7. You can find her Zoom link in the Dean's Corner messaging under math tutoring, and she'll be more than happy to assist with the math portion of the tutoring. All right. I wish you guys well. Good luck to you all.